Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Identified. It's kind of what you were saying. We wouldn't know because we don't have the manpower to do it. Any other thoughts on life outside of the earth? Humans or existence, life. Any other thoughts about it? And James, he mentions we're the first of his efforts, and I imagine by now there are many other examples of his creation of life. Any other thoughts on life outside of the earth? Not interested, huh? Got enough problems with life on Earth. Worry about life outside of there.
Are we talking about alien life?
Yeah, aliens, yes.
Well, they've been flying all around the planet checking us out for centuries now.
Yeah, some think they've been here. They think that's what took place in Egypt with the pyramids and all those things.
I saw a clip from Neil deGrasse Tyson where he says that if you pass by a grasshopper, you wouldn't stop to have a conversation with him because he's not smart enough to actually engage. So they may have been here checking us out, but just didn't have a conversation because they didn't feel like we were smart enough to engage. We were just like grasshoppers to them.
Interesting perspective. Happy New Year to everyone who's on. I'm glad that God has blessed us to allow us to see 2024 and all the good and bad things that it brings to us. Okay, I guess we can start unless somebody else has a comment.
Hey, good morning, everybody. This is Sylvia. As I was logging on, I saw something that says AI companion is on. Do you know what that is?
I do.
What is it?
Artificial intelligent companion takes notes of this meeting.
Oh, it takes notes. Okay, because it indicated that it may ask you questions or something during the Zoom session. I was like, what is this? Something new?
It's John's creation. Yeah.
John Tatum. Okay. All right. Good morning. Happy New Year, everybody. Thank you.
This is an article that I put together to 13 ways to keep your brain healthy. Of course, this is number one is the thing that we talk about forever. Walking, jogging, swimming, lifting weights, yoga, tai chi, and dancing. All of these things improve your brain health. And it's something that we all must do in order to stay alive and stay healthy, and to keep our brain active. Mental stimulation becomes very important, as we've talked many times. Games like chess, checkers, bridge, other card games, jigsaw puzzles, dancing, listening, playing music, learning a new language, as some will want to do. All parts of keeping your brain active. Then we talk incessantly about eating the right foods. They talk about more fruits, vegetables, nuts, and seeds, grains, and all of these. And of course, the green teas and the turmeric teas and berry juices are brain health efforts. Then keeping your blood pressure normal and having a sphygmomanometer at home so you can monitor your blood pressure. keep your blood sugar normal, and your doctor will look at hemoglobin A1C and your blood sugars to make sure that, because when your blood sugar is out of normal, then it causes all kinds of diseases, all kinds of problems, as diabetics are well aware of. Keeping a normal cholesterol level is something that you need to be aware of, so that your doctor and you know what your cholesterol level is. And if your cholesterol level is abnormal, then medication may be necessary if what we mentioned above is not take care of it. And we have to be aware that sometimes even lifestyle changes are not enough, and that medication may be necessary. Avoiding all tobacco products is something that we should try to advise our children, grandchildren, and great-grandchildren, so that they don't fall prey to the poisons that we have created. Sleeping 7 to 9 hours every day is sometimes tough to do, but something that is good for every part of our body. Reducing stress through meditation, prayer, and exercise together, aiming at 150 minutes a week of each, becomes something that is great. And then avoiding the stigma of mental health and understanding that mental health professionals are just as important as the health professionals for the rest of the body. So that stigma of going to the psychologist or the psychiatrist is something that has plagued us and needs to be eliminated. Then something as simple as protecting your head and perhaps keeping your children and grandchildren from football. Maybe some of the things that we need to do, because when you get moderate to severe head injuries, this increases the risk of later on developing dementia. Then building and maintaining social networks. I say go to church, belong to a group, or join a choir, or become a musician. Yeah. Those are things that help us stay alive and stay active, and avoid alcohol. And if you choose to drink, limit yourself to 1 or 2 drinks a day. Some people think no alcohol is the best remedy, but the Bible says drink for the stomach's sake. And so eliminating alcohol is something that some may think is advisable, but most of the health advisors say 1 or 2 drinks a day is not harmful. Then finally, the recommendation of taking low-dose aspirin, if you can take aspirin, because it does decrease the risk of vascular dementia. It has its own side effects that aren't desirable, and that's why we say talk to your doctor about it, because it doesn't necessarily apply to you. Any other comments about these 13 ways that we have suggested to help improve your mental health?
Yes, I have a number 14. The National Institute of Health recommends sexual activity is associated with higher scores of tests of memory and executive function in adults aged 50 to 89. Maintaining healthy sexual relationships in later life may be associated with better cognitive function. And for the younger folks, whatever your age, research suggests regular sex can benefit your brain health. In a recent study, when women aged 18 to 29 were asked to memorize lists of faces and words, those who reported having more frequent sex had better verbal recall. So this is possibly a prescription that doctors could write. They could write the prescription, ordering the spouse or significant other to give it up on a more frequent basis for the benefit of their partner.
Thank you for number 14. Great. Thank you very much.
Good morning, everyone. That is really kind of eye-opening what Darryl just said, because I remember back in the 60s when I was in high school, one of my girlfriends was having trouble. I guess now you could say a mental illness. We didn't call it that, I guess, back then. But when she went to the doctor, um, she came back and told me that her doctor told her that she needed to have sex. That was she just needed to get involved with someone, and has that was way back then. And then later on, one of the girls that went to church with me, and she also said the same thing, that the doctor told her that she needed to get a partner and get to be sexually active to help her mental state. So that's not new, is what I guess I'm saying.
Also, several months ago, there was an article in AARP saying the exact same thing, but they labeled it as sexual activity over 70 and over, and it increases the memory and lessens dementia, improves your health.
So we're on one accord. Okay, wonderful. Okay.
Dr. Callender, what
Yes.
is vascular dementia as opposed to maybe other kinds of dementia?
It's dementia that is caused by small blood clots and emboli that decrease the oxygen that gets to your brain, and this is one of the forms of dementia. It's not often as talked about as Alzheimer's, but it is a situation in which you have small blood clots and emboli that decrease the circulation to the brain and cause dementia of its own right. So that's vascular dementia that low dose aspirin may help prevent.
Thank you.
Okay, let's go to the next one. Thank you for item number 14. I'll add that to the list. This is an article that talks about the top advances for 2023. I thought it's a little bit complex in some instances, but I think one of the most important aspects is the number one, that one of the biggest problems in the world today is cardiovascular disease, and hypertension is the leading problem associated with cardiovascular disease. And so boosting medication adherence and monitoring and controlling the blood pressure goes a long way to increasing the lifespan. So this medication that lowers the blood pressure with one single injection is encouraging, though time will tell whether this will actually be the panacea that it appears to be. But anyway, that's a novel new 2023 advance. Then found back to me, even in the most severe stroke cases, the fact that this is a treatment for small and medium-sized strokes and allow people to experience fewer disabilities is something. So that it emphasizes the point that if you have symptoms of a stroke, it's important to go to the hospital as soon as possible, so they can, if it's a thrombotic ischemic stroke, they can remove the clot. That doesn't help for a hemorrhagic stroke, but at least for the thrombotic strokes, it is treatment. It does work and decreases the hemiplegias and the paraplegias. Next is the stents. Stents that go a long way to helping overcome the clots that occur in the coronary arteries, which kill people and cause major disabilities. And the ability to revascularize with stents has become a major health advance. And this is becoming more and more a way of preventing death from coronary artery disease. And then atrial fibrillation is not infrequent in people over the age of 70. And the early use of medication to like Eliquis and other medications like that actually prevents strokes. And so that's something to be aware of, it, especially if you have atrial fibrillation. Either you have the atrial fibrillation corrected or you get on anticoagulants to prevent strokes. And then it's one of the things that has taken has become very popular is the recognition of medications for diabetes, some of which are used for management of obesity. And this has gone a long way in treating obesity with or without diabetes. So that was a important advance. And then, of course, the social determinants of health continue to fuel things, so that if you don't have the ability to get good food, to go to a doctor, and to get good health care, the likelihood of you to die from is in a much earlier age than others is something that we learn to deal with. And more and more evidence is pointing to the fact that healthy eating lowers the likelihood of you dying early. So adopting a healthy lifestyle becomes important. And then the Association of Cardiovascular, Kidney, and Metabolic Disease is not new, but it's an old, super warmed over that talks about the importance of adopting a healthy lifestyle and avoiding eating the right foods and preventing heart disease, kidney disease, which take away most of the people in this earth. We're now also, I guess this is the last one, we have a less invasive treatment of advanced peripheral artery disease, which usually was treated by surgery. And now we have other ways of treating advanced, which cause amputations and the loss of limbs and other things. So we've come a long way in 2023, and these are just some of the ways in which these advances have helped us. Any comments or additions to that article? Now, this is a major development. You remember we talked last year about many people who couldn't afford to take insulin. And so this is a tremendous advance, so that the many diabetics who are on insulin can now not worry about not being able to get insulin. This is a very important problem that I'm pleased to see that has been responded to, because so many people couldn't afford to pay for their insulin. This is a sad 1 in 4 people with type 1 diabetes for whom insulin is necessary, rationed insulin because of the cost. And so this is one of the advances that has happened. And why is insulin so expensive? Well, you could have a number of answers to that question. One is that Big Pharma wanted to make more money, but there are a number of other reasons. And it is true, research is expensive. And so it's wonderful that we have responded to the need, and there was a great need for this to happen. And this gives you some restoration of faith in mankind that they would be responsive to this.
I had a question, Dr. Callender, just about diabetes and the lack of good insulin in the body. Is this a recent development, and
Is what a recent development?
the diabetes, I guess,
No, it's not a recent development. Type 1 diabetes has been with us forever. What is a recent development is that the insulin has become so expensive. That's the recent development, that people couldn't afford to pay for insulin. And for type 1 diabetes, that's the only treatment for it. And so diabetes is not new, but the fact that the price of insulin increased so much was what was new.
My question is more like what did we do before insulin was made, or
Died. Diabetics died.
period? Okay.
Yeah.
And it was in the millions of
What do you mean in the millions?
millions of diabetics died.
Yes, a million of diabetics, many of people had diabetes. They probably didn't realize it. And many of them died from it, still do, but not as many now because we have insulin. Now, type 2 diabetes is a different story because you don't have to take insulin for type 2 diabetes. In type 1, you have to have insulin. And if you don't get insulin, you're going to die from the complications of diabetes. Okay, if no other question, go to the next one. Now, this is just an article that reminds us of the vaccine schedule. And there are many articles that demonstrate that people are not taking vaccines as much as they should. But the availability of these vaccines is more evident now than ever before. And so we have an opportunity to take these vaccines. And an ounce of prevention is worth a pound of cure. And that is why vaccines are so important. And there's so many different types of vaccinations that are available. And this articulates many of them anyway. And it's interesting that many people, in spite of the availability of these different vaccines, have not availed themselves of all of them. The COVID vaccines, the RSV vaccine, the Mpox vaccines, the flu vaccines, and on it goes. The pneumonia vaccine, and so it's an important part of your health to keep your own vaccine schedule so that you know what you need to do every year and every 3 to 5 years.
Dr. Callender, I just heard an advertisement yesterday on the TV saying that this new pneumonia vaccine, even if you've already had a vaccine for pneumonia or two, I think that they might come in two stages, that this would make your protection against pneumonia even better, especially for the elderly. Have you seen that?
Yeah, I have, yes, and I think what it refers to is that the vaccine for pneumonia, for example, was in 2 stages, and what they have now is developed a vaccine for pneumonia that's even more effective than the one that previously existed. And so, for those who, even if they'd already had their vaccine, you could check with your doctor to make sure that you've got the full vaccination, and this new vaccine is even better than the previous one. So, yeah, that's true. Good information. Any other comment about that? Not an article that is perplexing, that female surgeons have better outcomes, and why. And it's an issue we've addressed from time to time, that some of the qualities that the female doctors possess that are superior to some in which the male doctors possess, and as a consequence, their outcomes are better than males. And it's interesting data observation. Any comment or?
Dr. Callender, I'd like to go back to our last article that we discussed. I'm sorry about going back, but it's something that just came to my mind, and I wanted to ask you about it. With the shots that we are getting, dealing with the flu and COVID and the respiratory and now the pneumonia, do these shots have any degree of effectiveness on the other shot? Do they work independently of each other, or do they interact?
They work independently. There's no evidence that they may protect against other diseases, but each of them seems to work independently, and one does not help with the other. There's no evidence that I've seen that demonstrates that if you take one, it helps with the other. They seem to be independently addressing the immune system. If that does exist, it has not been identified. Let's put it that way.
Okay. Thank you.
Okay, let's go to the next one. Next one. Well, this is an interesting, fits right in with the comment Darryl made that if you have painful sexual intercourse, this may be one of the most common manifestations of a urinary tract infection for women. And so if you do have painful sexual intercourse, this may signal urinary tract infection. This is a relatively new finding that we're sharing at this time. And the fancy word for it is dyspareunia.
Thank you. You read my mind. I was going to ask you to pronounce that. Oh, yeah.
What was the question, John?
I was going to ask you to pronounce that word, dyspareunia.
Dyspareunia. Well, that's my pronunciation, probably. But dyspareunia is what I call it. Okay, next article. Ambivalence. This is an interesting article that if you're not willing to take a position one way or the other, and you're just ambivalent, and it's equivalent to being complacent, is a disease that produces somebody to do nothing and not to make a change, and they stay the way they are, and they don't exercise, they don't do anything. They just exist. They're just ambivalent, and they're pointing out that this is a disease which we need to conquer and overcome, and take a position, take a stand, and in our age of compromise, it's interesting to hear somebody point out that compromise isn't always great, and that not taking a position or a stance can hurt you. And this is pointing out that if you don't take a position, it's likely to work against you. So you got to take a stand. No one can ever say that Darryl doesn't take a stand. Yes, he does. And this is suggesting that this is the best way to be. Take a stand one way or the other. Don't just stand on the fence.
Yeah, I just can't get to my unmute mute button quick enough because going back to the last article, just like Joyce did, it talked about physicians and patients don't talk about sex often enough. So we got the depression screening questions at the beginning of visits, and maybe there should be some sexual activity screening questions as a part of physician visits.
I agree. I think that's a great thought, great idea. It would be more helpful for our health. Yeah.
But then you'd have some patients that
it's interesting that the Bible talks about fornication, and it's as a sin. Sex without marriage is a sin. And actually, what we're saying now in many instances is that sex is something that is desirable. So that's an interesting commentary that demonstrates that we have gotten away from some of the biblical teachings, just as we still fighting over homosexuality and all of that. So that and that is one of the big concerns about the church is that dealing with sex and sex education had not in the past been something that was foremost in the minds of the churches, except to say that fornication is sin and adultery is sin, so forth.
I would like to point out that both of those women that I talked about earlier were single women, but the doctor prescribed sex for them.
I'd like to see that written down on a prescription pad.
Not likely to see it.
Dr. Callender, this ambivalence, does this have anything to do with if you're not part of the solution, you're part of the problem?
Yeah, well, yeah, ambivalence means you don't take a position one way or another. So, yeah, in many ways, yeah. But it's also a slap on compromise because, many of us are willing to compromise everything and not take a stand. Whereas it's saying taking a stand is good for you. Compromise and ambivalence sometimes is a weapon of destruction.
Okay, Dr. Callender, how do you if two people are taking a stand and they're just totally opposite, how do you resolve it without somebody fighting?
I think it's healthy for people to have different opinions. I think that's
how do you have different opinions without an argument?
Well, you just have friendly difference of opinions. I mean, my wife and I have different opinions every single day. But
and y'all real friendly.
Yeah, we're friendly, but we still have differences of opinions. So I think it's healthy, and it's very provocative to have a difference of opinion with somebody else without having arguments. I don't agree with you. Okay, we can disagree and still be friends and still love one another and have different. For example, I'm from New York City, so my ways are different from her. She's from the South, and so we differ in many ways. Opposites sometimes tend to attract, and I think that's desirable. Just as diversity begets ingenuity. The more different you are, the more likely you are to have different opinions, and I think it's very healthy.
I've heard that in relationships where it's always peaceful, that it's very often the case where one of the partners in the relationship is not standing up for their beliefs. And arguments, friendly arguments are definitely healthy for relationships. That's what I've heard.
Any other comments on that subject?
Yeah, my comment would be that when we say standing up for your beliefs, that's another way of saying unwilling to learn. People just don't have open minds. Arguments can be a wonderful thing if the conflicting parties are willing to learn from each other. That's what life is all about, learning. You close your mind and you're not willing to entertain different opinions. But if you learn, your life is going to be better.
My overall saying about arguments, people take that the wrong way. They think that arguments are fights. But to me, especially in my field, arguments are points of view. That's all they are. Your argument is this way. My argument is that way. It's a point of view. It's a debate.
I disagree. Just for joy. I'm just kidding. I'm just kidding.
Yeah, I was going to argue with you about that.
Very healthy. Very healthy.
Very healthy. I can remember plenty arguments, disagreements, discussions between John Tatum and I when we were on the trustee board together. They would ultimately end up with saying, we just agreed to disagree.
Exactly. I had a different point of view than you had.
Many times.
But one statement was true, to keep an open mind. And that's one of the hardest things when you're very opinionated, to say maybe the other person does have a factor. I believe this way, or point of view, but be able to keep an open mind that the other person, their basis could also be true. But if you only believe that your point of view is true, then it's just two brick walls together, because nobody is actually able to maybe realize you do have a point there. And I have a point. And I look leery at people that said they've been married and they never had different points of view and they always agreed upon everything. Then one of them, they definitely have to be a bit, what is that word?
Ambivalent.
Ambivalent, because most people do have a different point of view. And they have to just say, okay, whatever. And they have that ambivalent type of behavior. And I've seen it a lot, especially in group dynamics. Most people say, well, I don't care which way y'all go one way or another. I'll just vote with the majority.
Well, I've been married for 55 years. And one of the things that we men talk about is the fact that a happy wife is a happy life. And as a consequence, many of the male may say yes when what they're saying is, I'm not going to argue about it because I'd like to have a happy life. Mark, your hand is up.
I agree with all the points of view so far. And I also just want to add, I feel like it's also up to a person's level of pride that I've noticed, and I'm just watching people. People take a pride in being right, and that could be, self-fulfilling and so forth. But I've noticed that the more and the deeper that I got into grad school, that like the more you study, the more you realize how much you don't know. Um, and how much there's a world of knowledge that could just prove you wrong. Even people who have started dissertations and research projects, they they have a theory, and then sometimes they'll have to prove their own selves wrong. They have to prove how their theory was wrong. So it's like a level of humility that you have to have when engaging with anybody. And I think pride prevents us from admitting when the other person is right or when they have a good point to bear. And I think a lot of people don't like that because they don't like to be wrong, or they have an identity crisis where they don't want to be seen as having misinformation. So it's like they have to puff themselves up. But I think, and I'll just land this plane by saying, I think if we could get rid of pride and add more humility, I think that'll also be helpful in all of our arguments and debates.
It's a very, very good point. And one of the things that I would argue that most people forget is that when you go for an interview, that's not a time or place for humility. There's a time and place for you to identify your strengths and how you've overcome your weaknesses. And I would say to you that the only place in life where humility is not your best friend is when you have an interview.
Agreed.
Yeah, I got one more thing to throw in there about the wonderful benefit of any type of argument. It's a wonderful opportunity to show a little used human skill in relationships called empathy. If you can really listen to that other point of view and respond back that you see their point of view, you can tell them that you can walk in their shoes, you can see the situation through their eyes, you can convey that empathy, you can establish a bond with that person that you never had before.
And I think what you point out is that one of the greatest gifts you could ever have is the ability to listen, because it begets an open mind and all the positive things that you already mentioned. Okay, I guess we've discussed that enough. These here again, 6 healthy lifestyle habits that are linked to slowed memory decline, as we all want to demonstrate that. We want to slow our memory decline. And as we age, memory decline, and this identifies 6. You want to go down the line and point them out. Healthy diet, being active, regular exercise, active social contact, no smoking, no drinking. It's interesting how many of these things are repetitive. But I think repetition allows you to learn. So you can see how we're all saying the same things about the same things. And so maybe we're agreeing on all these 6 things being important, helping us keep our minds sharp. It's amazing. It's interesting in the newspapers last week, they talked about, no, this week, they talked about 7 ways to keep your mental health, keep your brain active. And so here we've had about 3 articles on the same thing. So, and there's a common bond in all of them. Now, this is an article that goes a step further by saying that those kind of healthy lifestyle changes can avert young onset dementia, which is saying a lot, because we do see When they talk about young onset dementia, they're talking about if you're under 65. And we are seeing more of that. Bruce Wills and a good judge, a friend of mine, have developed dementia, early age onset dementia. And this identified some 15 factors that went along with it. Low education, low socioeconomic, APOE, no alcohol use disorder, social isolation, vitamin D deficiency, and low hand grip strength. That's interesting because that I haven't seen that in a number of articles, but that has come up recently as
Y'all can get through that bag.
I'm sorry? You made a comment?
No, they were just unmuted.
Oh, I see. Okay.
Go ahead and mute them.
And then hearing impairment, and I think Darryl has mentioned that many times, how that orthostatic hypertension, stroke, diabetes, heart disease, and depression.
You back up a little bit. That genetic marker, the allele polyprotein
APOE,
allele.
Yeah.
Is that something that you could be somebody could be tested for to see if they have those alleles?
Yes. That's a test that doctors can do now that can identify whether you're more likely to have dementia or not.
Is that something that could be
However,
covered?
carrying those two, and there's been studies that demonstrate that even if you have those two alleles, if you adopt the healthy lifestyles, you can overcome the 2-apolipoprotein E4 alleles.
Yeah. Is that a test that the patient would have to cover out of pocket, or could that be included in the annual exam? The annual wellness
I don't know
exam?
the answer to that. That's a great question.
Because
I don't know
I would
whether
think
I don't
if
know the
somebody had a
answer.
family history of dementia, that may be something that could be covered as part of the annual exam.
Yes, you're right. You're absolutely right. That's the way you could get it paid for. Yeah, because it is now well known that having two apolipoprotein alleles is associated with dementia. So, yeah, I think there's a circumstance in which the doctor could get insurance to pay for it. Well, it's interesting that the lower hand, hand grip is something that I've been seeing more in the literature about a handshake being a way to demonstrate whether you're losing your grip, your mental grip or not. Although because of the COVID, handshaking is not as common as it used to be. Do people still shake hands in your churches? I know they still hug.
Oh, yeah, they're shaking hands, hugging, everything.
Well, I don't go to church, but in the clubs, they're shaking hands.
Okay, all right. And hugging.
Maybe this panel can decide when we're talking about dementia and et cetera, and then Darryl brought up about the sexual activity. Women that are widowed, how do you alleviate that as far as Christianity? It used to be, and I remember a long time ago, deacons were always going to take care of the widow. And, I don't know if they weren't going by scripture or anything, but, their husband, pastor, and et cetera. And now we're recognizing that factor. What do you suggest to women that are older without a husband?
When you say, what do you suggest? I mean,
as far as their sexual activities.
Well, the Bible says that fornication is sin. So
I know. So that means they need to get married again, or what?
Well, 2 and 2 make 4, Carol.
But there's not enough men out there.
I know, that's right. You're right.
So I mean, so in Christianity, everybody has a cross to bear.
But then
Yes.
they'll have dementia, and then they won't know.
I mean, so that's where the grace of God comes in from, because I mean, Paul does say it's better to marry than to burn, but but he said, those who are married don't wish to be single. Those who are single don't wish to be married. So if your lot in life, if your cross is to be single, then you have to trust God that He'll take care of you to the end. If your cross is to be married, you have to trust God that He'll take care of you to the end as well.
2 Corinthians chapter 12, verse 9. His grace is sufficient.
Yes.
And he
But
does.
does that
forgive.
stop you from getting dementia?
Well,
grace.
Dementia is something that's going to occur to many of us. So, but as Mark said, we all have different crosses to bear.
And look, according to the article, drink alcohol.
But God does forgive. He does forgive. So I was 25 years in between marriages. So he does forgive.
Yeah, that's one of the amazing aspects of God's grace. Yeah. He does forgive, and He may cast many of your sins into the sea of forgetfulness. Yeah. If not, where would any of us be, right? Yeah.
Well, I brought it up one time before. Is okay, don't want to harp on it, but is sex toys the same as sex?
Say again?
Sex toys.
Yes, what about it?
Is it the same as having sex?
Yeah.
Not according to medical researchers. They say that it's a human touch that's most effective in the relationship between sex and physical health. So you get a sex toy, there's no human contact with that.
So it's just masturbation, which is a way of releasing sexual tensions. And that is not the same as fornication because of what Darryl had mentioned. Science advances in scientific measures to slow down aging. Seems like all of our articles today are addressing some of the same things that, Ponce de Leon searched for the fountain of youth and didn't find it. And we are eternally trying to find immortality for a group that is mortal. Hence many of our articles are addressing ways in which we can slow down the aging process and the way we can get closer to immortality, which is problematic for our bodies because our bodies are not meant to be immortal. And as we age, we lose many of our friends. And so if you live to be 200, you probably wouldn't have any friends. You might have some family members, but very few friends. So it's to a limited extent, nutrients and diet and disease, all of these things will help us delay the process of aging, but not eliminate it. And that's what we've all been talking about, trying to live longer and have a quality of life for as long as we live. And they talk about many of the age indicators, and we now know that telomere shortening and there are factors that mitochondrial and other factors that are released that demonstrate the aging process. And we have identified senolytic processes that eliminate these so-called aging factors. And that's where the future lies in terms of trying to identify those factors that do away with those things that cause us to age. I know in transplant, it's been identified, for example, that when you take a younger organ and give it to an older person, that they're more likely to have some of those aging factors decreased. And this is an area of great research, although even more greater research could be done into the diets and the foods that we eat that cause us to age. So it's an interesting process where we want to live as long as possible, but yet there's a movie called Adelaide, I think, in which this lady has an accident and she doesn't age. Everybody else ages around her, and so she loses all of her friends, and even her daughter ages, and the daughter becomes old and gray, and she still looks young. And so it's something that we all like to achieve, but should we achieve it, would we be happy? It's a question. Any comments about all of our efforts to live longer, healthier lives?
Dr. Callender, what you were saying is very true about my dad, because he lived to be 102, and all of his friends his age had died. So he moved down a level to, those people who were 20 years younger than him. They were his friends. They were my brothers, my younger brother's friends. And he assumed all of those friends as his own. He started playing cards with them and hanging out with them and going to events with them and everything. So what he did was he just moved down 2 or 3 levels to continue having friends.
Amazing, amazing. Well, it's interesting that, now this is a new ultrasound tool that allows Alzheimer's drugs to get into the brain faster. It's interesting, but these drugs still don't, so far, have not been able to make a difference. But as we get more tools to help us get drugs to escape the brain-blood barrier, it may be that some of these Alzheimer's drugs will have an effect. They haven't so far, but time will tell. One of the biggest problems is that I'm not sure we really understand what is really causing all these plaques that cause Alzheimer's. And that may be part of the problem. Because we don't have a single drug that we now would say is able to overcome the negative impact of the plaques that develop in the brain and cause the Alzheimer's disease. But anyway, this may be a step in the right direction. We keep looking because we do know that more blacks have these amyloid deposits that are associated with Alzheimer's.
Yeah, I was watching a YouTube clip from a medical researcher who said that bacteria that escapes the large intestine, was called leaky gut, and there's really not, a formal medical position on leaky gut. Some doctors say it's a thing, some others say not. But anyway, this doctor was saying that the bacteria that escapes a leaky gut, it heads straight to the brain because that's the body's major repository of sugar, of glucose levels is higher in the brain, and that these bacteria settle in the brain and leave brain plaque as a residue that causes. And okay, the researcher was saying that the reason why Alzheimer's and dementia is more prevalent in today's world is because of the increased incidence of processed foods that lead to leaky gut.
Okay. Next article. It's interesting. Can of particles in dairy and beef cause cancer and multiple sclerosis? Well, there's so much argument that it does that zoonosis is a situation in which a disease comes from an animal and goes into a human being. And this then is what happened with AIDS, and then of course we now know that human papillomavirus caused cervical cancer, and we now have a vaccine for that, and this goes along talking about bacteria and parasites can lead to cancers, and viruses can lead to cancers, and the question really is, what is cancer and what is the common denominator that is associated with cancer? Because you have so many other issues that are involved with the development of cancer. And since that's such a common cause of death after high blood pressure and stroke, a lot of it would help if we could really understand what is cancer. Cancer is present so many forms, and cancer is so much more common as you age. And so we recognize that the immune system plays a large role. But having a real true understanding of what causes cancer becomes an issue. And we've often talked about breast milk is healthy, and about if you breastfeed your children, you're not going to get cancer. But people who breastfeed still get cancer. They're less likely, but they still get cancer. Colon cancer and the other cancers, lung cancers. All of these things have lead us to believe that there's many causes of cancer. Virus is one of them. Bacteria may be others. And so I think that I'm skeptical as to us really understanding what is the true nature of cancer. And I think the cure of cancer will not really be ultimately found until we really identify what is common about all cancers, which I'm not sure that we know.
A lot of people just think that diseases are luck of the draw and genetic. Like I didn't do anything to cause this, and I got the cancer. I got diabetes. I got hypertension, and yeah, there might be some genetic predispositions, but I think a lot of our current big three diseases like cancer, diabetes, and hypertension, all three of them are inflammatory diseases. And it says inflammation is considered a hallmark of cancer. And there's a lot of food products that trigger or cause inflammation. And so, our diet has changed over the last 60 years or so, as far as the way food is being delivered and processed in America. And so, maybe the real prevention goes to trying to limit or eliminate the foods that are very typical for triggering or causing inflammation.
I think that's true as well. The question is, which is the major contributor? And it seems to me that much of the evidence suggests that we are what we eat, and that that along with our environment plays a major role in how long we live. Next article, please. Flu is hitting hard, and of course, January and February are the months in which it hits the hardest. And hopefully everybody has gotten their flu vaccines. And we know that the death rate is highest in the group where they don't have the vaccines. And hospitalization rates and death rates are increasing because of the respiratory illnesses all over the country. And the people that are hit the hardest are those who are not vaccinated. So the question is, what will the rest of January and February bring? And most would say it's predictable that there will be more hospitalizations, more deaths.
According to this graph, our area, District of Columbia, has a high respiratory illness forecast.
Yep. Yep.
It almost looks like a weather map too. The warm weather states seem to be very high.
So this is something that we know we can do something about. So let's advise our children and grandchildren to get vaccinated. And the sick people to stay home. The other thing. They still emphasize wearing masks and washing your hands, and these 4 things here are best advice we have.
So now if you're sick and you go get tested, they test you for everything under the sun.
Yeah. Home testing is valuable as well. This is an article that talks about the sobering facts that alcohol and cancer are related. And that the more people drink, the more they have cancers of the liver and other organs. And this was a global study that pointed out that the more we drink, the more we have cancer. And it talks about the ways in which the alcohol contributes to cancer, and that the more you drink, the more likely you are to have cancer. It's funny how some people can drink and get all these diseases, and some people drink and never get any problems at all. And yet some people take 1 drink or 2 drinks and they become alcoholics. Alcohol and nicotine are the 2 that seem to be closely linked to cancer.
Dr. Callender, cirrhosis of the liver can turn into cancer? That's a question.
That's a fact. The process of cirrhosis means that the liver cells are destroyed, and this destruction can, in some instances, trigger liver cancer.
And what about fatty liver? Where does that play a role?
Similarly, fatty liver can result in cancer as well. Fatty liver disease, and of course, we know that it is reversible in some instances. This is an article that looks at smoking and talks about how many decades it takes you to revert to normal in people who stop smoking. So you're talking about sometimes the negative effects will take 20 years to overcome. And COPD is sometimes a consequence of, is often a consequence of smoking, as well as lung cancer. Cardiovascular disease, cancer, and respiratory mortality. You can see how they relate. And as time goes on, the risk goes down. I'm not sure that we can do the same thing for alcohol. Well, we can certainly do it for smoking. It's amazing how some of the things we take poison us, and how these poisons become addictive, how these addictive phenomena shorten our lifespan. Okay, Joyce, thanks for spending time with us. This is something that I thought was coming as soon as I saw the congressional hearings. And after the hearings, they had that picture of Claudine Gray that they focused on. They didn't focus on the other people. They focused on Claudine Gray. But now we've had the president from Harvard and the president from Stanford both resigned because of research. And I think the emphasis on why she stepped down is because of the plagiarism. But both of those presidents stepped down because of, now of course with Gay, they also talk about anti-Semitism. But so that the only president that remains that was involved in the congressional hearing is the president of MIT, which is a private institution. But the president of Pennsylvania stepped down, and President Kay now stepped down, and so MIT's president remains. Anti-Semitism, plagiarism. What about plagiarism? And you talk about intentional or unintentional plagiarism. And what that refers to is whether you give credit to people who did the research in your written documents. And whether it's intentional or not, if you do not give credit to them, then they come after you. And in this case, there were multiple people coming after her on charges of plagiarism as well as so-called anti-Semitism, which she was never really guilty of. But anyway, she had to resign as a consequence. What are your thoughts about this? Any comment at all?
Yeah, I hate to see it. I didn't look into the details of this, but on its face, I see a black woman, being castigated, in front of the masses, right or wrong. And I was first of all, I didn't know that she was the president of Harvard, which is a good thing. But now I see that they're quick to kind of take it down. That was just my first take, but I'll look into the details a little bit later.
But Dr. Callender, I'm trying to understand how you have people who look at your papers before they are published. You have advisors and people who look at stuff. So how come they're finding something years later after something has been published? I mean, because my papers went through scrutiny. If I didn't, citing where I got, because it wasn't, I don't had an original idea, but I used it to develop my papers and I gave them credit. And that was the main thing. So I'm just trying to think how did they find it that was done?
Well, in Stanford's case, one of the students looked into his thesis and identified two instances in which he did not give credit to people who had done the original research. In Gay's case, apparently there were more than one or two instances in which they identified plagiaristic. But to answer your question, how come they missed it in those cases? I suspect they missed it in many of the cases because I don't think it's intentional plagiarism. I think it's plagiarism that occurs because they weren't as disciplined in giving credit to some people. And but unfortunately, plagiarism, intentional or unintentional, is a cause for disciplinary action.
Right.
Maybe
It's important.
Yeah, maybe they felt too it might have been unintentional. She had to step down as president, but from what I understand, she is still a part of the staff. In what capacity, I don't know.
Well,
But
both of them are part of the faculty. They just had to step down as president.
Mhm.
My thought process is why did it come up after these hearings?
Well, actually, it came up before the hearings.
The plagiarism?
Yes, it came up before the hearing.
Oh,
Actually,
here's the
it's just
deal.
coincidental that they used that to get her out of it. But the plagiarism accusation came up before the hearing.
we just didn't hear about it, I guess.
No, they said that they said it was permissible, but after the hearing, then they focused on it.
Oh,
but it had come up before they did.
These were panels where the university presidents had to address anti-Semitism on their campuses, and she did not come out strongly in support of anti-Semitism. A lot of her campus protests at Harvard have been talking about the plight of the Palestinians in Gaza, how they're what the Israel Defense Forces, what they're doing is genocide. That's what a lot of the protesters. But when you talk about genocide by Israelis against Palestinians, and it's anti-Semitism, but it's not really about the ticky tack of what's involved in her papers or her doctoral thesis. The main point is that you go up against the Anti-Defamation League, and that's the league that controls a lot of our media. And if you go anti-Semitic, you're going down. And so it wasn't just Claudia Gay that went down. It's some other university presidents that stepped down under pressure too. And the point is that it's a juggernaut. You go against them, you're going to get hurt.
Yeah, that's kind of what I was talking about. It happened after the fact, not Yeah.
But that is not true about plagiarism. Plagiarism happened before the fact.
Okay.
The
I know, but you
anti-Semitism.
see,
But
they,
it
they
didn't.
found they're going to research. They're going to find some dirt on you. You know, you could
Yeah.
either step down or they're going to dirty you up enough to make you go down. But like Harvard was saying that it didn't violate the university's research misconduct
That's
standards
correct.
in their published works.
Mhm.
But there was enough pressure on her. They dirtied her up enough to make her go down.
Right. Mark, you had a comment?
Yeah, so this still does smack of racism very much, even as I look at the last sentence here. You know, inflammatory words. You're saying this is, you know, I'm coming in mid-sentence. It's just the beginning of what will be the greatest scandal of any college or university in history. Like that's, you know, no, that first of all, again, with her being a black face, you know, they're trying to, like I said, castigate her. But number two, you know, uh, what is not being said, you know, first of all, they're saying the greatest scandal. Like that. So what I'm trying to get out is that, you know, there's all kinds of important term, there's white collar crimes and all kinds of, you know, misappropriating funds, you know, those are scandals also. But for some reason, you know, this you know, this vile form of plagiarism and so forth, you know, is the greatest scandal like that. So I think it smacks of racism to me. I think, you know, they're trying to, you know, set an example, trying to say that this is the greatest, but unbeknownst to everybody else, like there's been college scandals, university scandals before, but to try to make this to be the greatest, it smacks of racism.
Well, but why would I don't see why it would be called the greatest. The guy from Stanford would just have just resigned because of plagiarism as well. So it's not it's just something that plagiarism is becoming something that they're using as a weapon. I think Darryl's point about going against against the Jewish
ADL.
Defamation League is something that always seems to happen. If you go against them, that's a problem. Also, you got to also be fair and recognize that one of the calls of Hamas was genocide, kill all Jews all over the world. So both of them take the same position. So both of them were genocidal. You know, it's not one over the other. Both, I mean, and that's what actually caused Gay to have a problem is that in Harvard, they alleged that the Jewish students were not being protected, and that's what got Congress into action. And one of the things that Darryl mentioned is when you go against the Jewish Defamation League, that you're asking for the elimination of whatever you want.
Agreed.
Dr. Callender,
Also,
would
if
you
you go against any of the ones that are in control, you're down. And we remember Bill Cosby. The only reason he went down is because he was getting ready to buy a major television network.
Absolutely. Absolutely.
That's the only reason he went down. And I mean, they took out all their guns and everything and exposed him to the fullest and still trying to do it, even so that they can't even bring back his television because they're still mad that this black man had enough money to buy one of our major networks. So we got to stop him. If Oprah didn't buy, if she didn't start her own and buy one of the major networks, Oprah would have done something. They would have done something to Oprah to bring her down. But other than that, they let her ride because she's not meddling in their business. So we as a race have to recognize this. When we do anything to bring any of them down, whether it's, and I hope I can't say this, whether it's anyway, non-white, Jewish, whatever, you're going to be brought down on your knees and gotten rid of, because they all are doing the same thing. Not that saying that right is wrong or wrong is right, but you can get dirt even on me if I got enough money to buy a major station, even on poor Dr. Callender. No, they couldn't find nothing on him, but me, they could.
They'll find plenty on anybody. They'll make it up if they can't find it. John Buchanan.
Yes.
John Buchanan.
Speaking of making up stuff, Chat GPT, you can tell Chat GPT to make an article for you. Would that be considered plagiarism?
Say
No,
again, say again.
AI, artificial intelligence.
Yes.
You can use that to write letters, to write papers. Wouldn't that be considered as plagiarism?
no, I don't think so. And the reason why I don't think so is because plagiarism is using somebody else's words, a person, a live person.
Why? What's the difference?
The difference is that
AI is not
that's
live.
in specific. Yeah, that's not specific.
Yeah.
AI is not specific.
Yeah.
The plagiarism is when you use somebody's work that's already been done and you don't give them credit for it, whether it's intentional or unintentional.
Well, if you use AI and don't give,
No, AI is not a person,
It's not a person.
but it's
Okay,
not yours.
here's
but
the
it's not a
deal.
person, so that's not plagiarism.
All right, this is according to the library guides. It says, doing academic work requires that the work you turn in is your own. A paper that is written by AI is not considered your own original work. It doesn't matter which AI program software you use. Any of these, use any of them to write your papers is considered a form of plagiarism. So whether you copy somebody else or you use AI, plagiarism means that you did not write it on your own. That's what plagiarism really means.
The other thing too is plagiarism can go to court, but I don't think you can take AI to court like that.
It's not AI's fault. It's your fault.
Yeah, but who's going to take who to court? That's what I'm saying.
Well,
Well,
Google
the
says if
point
AI
is,
writes it, it's plagiarism. That's what Google says. I'm
I
not
know,
trying to
but I'm
argue.
talking about,
I'm just trying to say what Google says.
yeah, I know. I'm talking about court now. So plagiarism can end up in congressional hearings. And so who's going to take AI in front of the Congress to testify? See, that's what I'm talking
well,
about.
it's interesting because in school, I'm chairman of the honor council, and one of the instructors brought up the same concept that the students were, instead of writing their own stuff, they were writing what AI had, and he considered that plagiarism, just as Darryl had mentioned. So it's interesting, but because if it's not your own work and you got it from somebody else, then that's considered plagiarism. That's what they accused the guy at Stanford of, and that's what they accused Dr. Gay of. And they did not say that she was not plagiaristic, it was that it didn't violate the university standards. That's what they said for her.
And
Yeah.
when you go to court over something like that, you're not suing the person whose work you copied. You're suing the person who did the copying.
Right.
You're not taking AI to court. You're taking the person who used AI to make up stuff that's not their own. You're taking them to court.
And then
Yeah.
probably before the court step, I mean, I would think that they would do it in-house too. They would do it at the university level, but where you go before a panel. So even before you go to a legal court, they would have to go to the court of the university where their opinions would count and kind of weigh in on what kind of decision they're going to give to you.
But it's
And
interesting that in both presidential cases, they did do that. But in both cases, they were required to resign on the plagiaristic situations. But I always wondered how if you looked at anybody's paper, you could find some evidence of unintentional plagiarism. I don't know. I've published at least 150 plus papers, and I quoted a lot of my work is based upon my own work, but a lot of my work I tried to attribute to everybody I could. I guess we all make mistakes. Anyway, it's food for thought. It's past 10:30 again. I guess we could move on because we could talk about plagiarism and that forever, I guess. This is very similar to a case we had before, where this lady had a schizophrenia and developed and actually had an autoimmune disease that was treated by steroids, and she woke up. And this is a similar case of a lady who 20 years was diagnosed as schizophrenic, but later was found to an autoimmune disease, which was then treated, and she woke up. And it's a good example of how we think we know a lot, but we don't know it all, and sometimes our mistakes are overcome, and sometimes they aren't. And this was an interesting, frightening case. So how many people in the mental institutions fit into this category? That's a good question. Let's go to the next article. It's 10:30.
Yeah.
We'll go to the next article. This is an interesting case that Florida State General asked a question about DNA particles that they could lead to cancer. And that's his allegation. There's no evidence that it will cause cancer, but he raised the issue. And because he did not get an answer that was appropriate, he said that these vaccines are carcinogenic. And the truth of the matter is, the answer to that question will not be actually known for the next 20 years. We don't know. But he doesn't have any evidence that that it causes cancer. But he has the fact that they do have DNA products that conceivably could cause cancer. And so he then is suggesting that they could cause cancer, and that's why he made this statement. So you read this again and again, and the truth of the matter is, the only way you know is if 20 years from now we look back and see whether this was true or not. But the fact that there are DNA, that there is DNA in these RNA products is a question. But that's what this article is about. And so it's going to be interesting to see what how these arguments go on and on. Legionnaires is a disease that we know of, and it is the New Hampshire resort. It's a bacterial infection that caused trouble in Philadelphia a long time ago. And now in New Hampshire, this Legionella bacteria caused the death of 2 transplant patients. People who are immunosuppressed are fair game for bacteria like Legionella, and this is what caused their deaths. And this is frightening and scary for all of us. And this is this the last article?
Yes.
Okay. And last week actually Mark talked about Inspire, which is a new way, a relatively newer way of treating obstructive sleep apnea. And CPAP is the treatment for obstructive sleep apnea, and it is good for obstructive sleep apnea. What this study shows is that it isn't a great treatment for cardiac heart failure, and although it is treatment for hypertension, it is not treatment for coronary artery disease. And there isn't any work that indicates that obstructive sleep apnea is actually the treatment for CVD outcomes. It's the treatment for hypoxia. But anyway, this article says that CPAP is over publicized and doesn't do what it's intended to. And I would argue that that is not the case, although they bring a case here. The treatment obstructive sleep apnea causes hypoxia. Hypoxia is the thing that causes the hypertension and the other side effects that are associated with congestive heart failure. And so This article is of the opinion that CPAP is over publicized. I don't agree. I think it addresses and treats low oxygen levels. In the process, hypoxia also causes hypertension and many other illnesses that result in Blacks who have a disproportionate incidence of obstructive sleep apnea to have hypertension and many other cardiovascular complications. But anyway, it's a good article that brings a point of view, just as Carol said, that you can have differences of opinion and still exist. Elizabeth, you want to make a comment?
Yes. First of all, good morning, everyone. And yes, that is a great art along with the others. I have friends and families that use the machine, and one of the things I encourage them to do is to make sure they clean it so that bacteria is not in it. That's one of the most important things that I encourage them. When they clean it, they are surprised at what they see. And so, that care is so important. On another note, I want to say it's great to be back in person. And even though I tried my best to keep up with all your discussion, because all of them are just excellent. I really appreciate hearing the comments and hearing you guys talk. And it's great to get rid of the jet lag. But as far as, let me take myself off of this. As far as when we're talking about dementia and everything, one of the things that has helped me a great deal is this book that my book club read. Oh, you can't hardly see it, not enough light. But it's called Before I Forget by reference to B. Smith. And it gives a wealth of experience and knowledge and resources explanation. So this is really great. And thank you.
Welcome back and Happy New Year to you and to everyone else.
Happy New Year.
Okay, is this the last one? Well, thank you very much, boy. It's a wealth of knowledge and information. We discussed everything from the heavens to the earth, and robust discussions about everything. And it's good to have so many of you back again, and have a wonderful 2024. Any other closing comments?
Yeah, we discussed everything from sex to politics to religion, all in one discussion.
All of the topics that people say you can't discuss, we discuss. And we're still friendly to each other. Even though we may differ, we still agree to disagree, as Betty said.
I'd like to publicly thank John for helping me get my audio up and running again.
We have such geniuses, John Tatum and John Buchanan, and then of course the angel Carol Tatum. So we have to be thankful to all of them for this group that we have that functions so well and allows us to disagree.